Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Carvedilol. Its brand name is Coreg. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if any time during this video you find this information to be valuable, please consider leaving a like on the video, as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how Carvedilol works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Carvedilol. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does Carvedilol work? Well, Carvedilol is a non-selective beta-adrenergic blocking agent, or a beta blocker. It also has alpha-1 adrenergic blocking activity. In terms of indications or reasons we would prescribe this medication to a patient, we often see it used in hypertension or high blood pressure. It may be used in the treatment of heart failure, as well as in impaired left ventricular function associated with a heart attack or myocardial infarction. With respect to contraindications or reasons we would not be able to prescribe Carvedilol, we wouldn't give this medication to a patient who had a hypersensitivity to Carvedilol or to any other component of the formulation. If a patient had bronchial asthma, they would not use Carvedilol, as well as patients who have second or third degree atrioventricular block. Patients with severe bradycardia or severe hepatic impairment would also not use Carvedilol. Now what about dosing with Carvedilol? So in the treatment of hypertension or high blood pressure, the initial dose would be 6.25 milligrams orally twice daily. The dose may be doubled every 1 to 2 weeks, and the maximum dose would be 25 milligrams orally twice daily. In the off-label indication of angina pectoris or chest pain, we may see 25 to 50 milligrams orally twice daily. As with all medications, there are some side effects or adverse reactions that patients may experience while using Carvedilol, so I'll go over some of those here now. 3 to 10% may experience a bradyarrhythmia, while 2 to 20% may experience hypotension or low blood pressure. Peripheral edema may happen 1 to 7% of the time, and 10 to 12% of patients may experience abnormal weight gain. Hyperglycemia or high blood sugar may happen 5 to 12% of the time, and 2 to 12% of patients may experience diarrhea. 6 to 33% of patients may experience dizziness, and 13% may experience erectile dysfunction. Fatigue happens 24% of the time. Now, some more rare but serious side effects would be Stevens-Johnson syndrome or toxic epidermal necrolysis. That's all we're going to talk about today with Carvedilol or Coreg. As always, I'm very thankful you took the time to come by and watch one of my videos. If you thought the information was valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.